Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. National Epidemiologist, Dr. Shaluddin Ahmed. Medical Doctor at the Quarantine Unit and COVID Center, Dr. Tora Breedy. Acting Deputy Chief of Police, Davidson Valerie. Staff of the Office of the Prime Minister. The listening and viewing public, good evening. We welcome you to this COVID-19 update. As always, we'll be bringing across to you valid information, not only statistics, but we'll be bringing you information on how you can take your own preventative measures and the protocols that need to be adhered to as we continue to fight this COVID-19 pandemic. We'll begin the press briefing, as always, with the National Epidemiologist, Dr. Shaluddin Ahmed.
Honorable Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre, Dr. Tora Breedy, attending physician at the Quarantine and COVID Center, Superintendent Davidson Valerie, Head of Criminal Investigation Department, Ms. Shinahari, media, and viewers. Good evening to everyone. The number of confirmed cases of COVID-19 is 22. The last two cases were detected on August 28th and August 31st. Both of these are imported cases. Both of these were screened and placed under quarantine prior to confirmatory testing. One of them is a 34-year-old female, and the other one is a 22-year-old male. Both are asymptomatic, and currently they are at the COVID center. So far, we have identified a total of 18 contacts from both of these cases. 2 are negative on PCR, and 16 others will be tested at an appropriate time when the viral loads are likely to be higher. So just to recap, our total number of confirmed cases so far since March is 22. Total active cases, 4. Total recovered cases, 18. Total number of deaths, 0. Total number of contacts identified from the last 4 new cases, 60. Total number of contacts tested negative from those 60, 44. Total number of contacts pending for PCR testing are 16. So with this, I thank you for your attention.
Thank you very much to the National Epidemiologist, Dr. Shaluddin Ahmed. Of course, Dr. Ahmed and his team continue to work diligently to do the contact tracing and to ensure that those of us who need to come into Dominica, that the services can be provided to you as far as the completion of your forms and your approval notice. So again, we thank Dr. Ahmed for his continued efforts. Next up this evening, for the first time, we welcome Dr. Tora Breedy. Dr. Breedy is a medical practitioner who is at the Quarantine Center and also at the COVID Center. Of course, Dr. Breedy would work very closely with the quarantine staff to attend to those who are at the Quarantine Center and would have first-hand knowledge of what transpires at the center. So we welcome her this evening.
Good afternoon to all. Thank you, Mrs. Shinahari. Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre. National Epidemiologist, Dr. Amid. Head of Criminal Investigation Department, Superintendent Davidson Valerie. Good evening to all. I am here tonight to give a brief explanation about what goes on at the government quarantine unit. First of all, I would just like to mention what is quarantine. Quarantine is a strict isolation imposed to prevent the spread of disease. This system of measure has always been done by governmental authorities at the port in order to prevent the spread of diseases. During this COVID-19 pandemic, government quarantine units have been set up and are used in order to isolate persons that have arrived from elsewhere or have been exposed to this infectious or contagious disease locally. Persons who have traveled from overseas are at a higher risk of being exposed to the COVID-19 disease, which is infectious and contagious. Therefore, upon arrival into our territory, our national COVID protocol states that these persons have to be set apart or separated from other persons. Quarantine can be done at private houses, assigned government quarantine buildings, or certified COVID hotel for a set period of days. In general, everyone who traveled from overseas has to be monitored upon arrival into Dominica in one way or the other. The number of quarantine days and the place to be quarantined will be based on our country's standard risk classification system, which is based on the country of origin, whether or not you have a PCR and the duration of it or the date it was done before arrival to the country. It will also depend on the results of a rapid test, whether you have been exposed or not, and whether you have COVID symptoms, and the other online questions that have to be filled out. The reason why quarantine is important, as we said earlier on, it is to separate and restrict the movement of people who were exposed or who have been potentially exposed to this contagious disease. In this instance, it's the COVID-19, to see if they become ill. And in the event that they become ill with the COVID-19, they can more readily be isolated and managed at a COVID unit, which we have two of them, one in Portsmouth and one at the Dominica China Friendship Hospital, thus preventing large amount of the population from becoming ill and overwhelming our health system. Also, quarantine will also allow for the monitoring of signs and symptoms of COVID in a safe and controlled environment. Many of you must be asking, how are your family members going to be taken care of at this government quarantine? Upon arrival to Dominica from the airport, Douglas Charles Airport mainly, travelers are taken to the government quarantine units on buses provided by the government, which are the quarantine units are in Portsmouth. Government quarantine units are in Portsmouth. They are received at the unit by the health team and are admitted. While at the government quarantine unit, each person is provided with a room and which has the basic necessities like running water, hot water, electricity, air conditioning. 3 meals are offered at a cost which is optional. The rooms are cleaned and sanitized prior to admission and on discharge of person from the unit. Situation where persons can share rooms. These situations are 2 persons, if there are 2 persons who have been living together prior to arriving to Dominica, children with their parents, spouses, husband and wife, and in cases where persons are disabled or elderly with dementia and Alzheimer's. They will be given room adjacent to their caretakers or family members. The length of stay at the quarantine unit will depend on the person's standard risk classification, their traveling history, and the results of their PCR. And when the PCR gets back to the doctors at the quarantine unit. I would like to share with you all the quarantine facility rules and regulation. During the stay at the government quarantine unit, each client will be assigned to a single separate room, as I explained before, where they are expected to remain until they are discharged. It is the client's responsibility to tidy up their room during their stay in order to minimize exposure to themselves and to the staff. An inventory of items in the room will be conducted in the client's presence. Daily temperature check will be done and COVID-19 related questions will be asked. At least 1 PCR swab test will be done, or we will be awaiting the results for one done at the airport. If the result of this PCR swab is negative, the person or the resident will be discharged from the government quarantine unit with a detailed discharge note. As I said earlier on, free healthy meals will be provided at a cost, but are optional, and no pets are allowed. The clients are expected to remain in the assigned rooms unless contacted by the medical staff for temperature check and meals, or if they are going to dispose of their personal garbage. Clients are not allowed to enter the rooms of other residents, irrespective of relationship. Clients are not allowed to bathe in the pool or sea based on the location. Client must wear a mask to safeguard themselves and others when in communal areas such as corridors, or when in conversation with the medical personnel or other residents at the quarantine unit. Client must respect the property and not damage or take away any of the items from the room. Client must make arrangement to have additional cleaning supplies, toiletry and bed linen if needed, delivered when needed. You can have your family members or friends deliver food and other personal supplies to you at the quarantine unit. The police and facility security will inspect the items before being delivered to your room. During delivery, residents are not allowed to have any physical contact with family, friends, or delivery persons. This is in order to reduce possible transmission. Please ensure that your family, friends, or delivery persons know your room number to facilitate a smooth process. Laundry is at a cost, or bring along sufficient clothes or linen for the duration of your stay. General discharge protocol, that's when you are declared COVID-free from our facility and you are going home. We give you some home quarantine protocol. The residents are discharged from the quarantine unit by a medical doctor when a negative PCR swab test is available and it's negative. This test will be available when the lab send it to us. Therefore, if the lab don't send it to us, we will not have it. After payment, arrangements are done with the after arrangements are done with the accountant who is based at the government quarantine unit. The form of transportation is only via private vehicle and COVID certified taxi. During your journey to your home, you need to wear a mask together with the chauffeur. It is better to put down your glass, avoid the AC, and please do not stop on your way, anywhere along your way. You go straight to your house. No public transportation will be allowed. Once at home, remain on your property until home quarantine has ended. During home quarantine, with other members of the family, always wear a mask, wash your hands with soap and water frequently, sanitize surfaces, practice respiratory etiquette and social distances. The district health team will make contact via telephone and make scheduled or unscheduled home visit as needed. Have a thermometer available at home. Contact the COVID hotline for questions as needed. Visit to any health facility has to be coordinated by your community health team or your medical doctor or via the hotline, the COVID hotline. Please do not make uncoordinated or unscheduled visit to the health facilities like the hospital, your health center, your private doctor, because you will not be welcome. There some news or new update. There will soon be available an online payment form or a machine at the quarantine unit. Also, a vending machine will be available at the quarantine unit very soon in order to be able to get your cold drinks and snacks, comfort food. Before I conclude this presentation, I would like to include this take-home message. We, the staff at the government quarantine unit, are always happy, willing, and ready to assist all the residents or clients who are admitted under our supervision. We understand that these are challenging times and that traveling and life on a whole has become increasingly difficult, which is why on a daily basis, we continue to work on improving the services and conditions at the unit. We are aware that everyone who is admitted at the unit has come to Dominica for genuine reasons, but it is also our duty to ensure your well-being before being released to your family and friends. Therefore, I would like to take this opportunity to make a plea on the behalf of the rest of the government quarantine unit team and myself. Please avoid being abusive to us. We are here only to serve you and to help battle a virus that has no respect of persons. Lastly, going forward, I would like to encourage everyone to try their best to adapt to this new normal that is the COVID-19 pandemic and what it has imposed on us all. In order to keep yourself and your loved ones safe from this disease, we need to take the stipulated quarantine measures very seriously. Thank you. Good night.
Our thanks to Dr. Tora Breedy. Of course, I'm sure we all heard the emotion in her voice toward the end. This is a very daunting task. It has not been easy for anyone, not the staff, and not for those of you who are traveling. But it is only through that kind of cooperation and understanding and patience that we can all get through this together. So I would like to echo her plea that those of you listening who are at the quarantine facility, those of you who plan to come into Dominica, there's a reason why these protocols are in place. There are reasons why you're sent to the quarantine facility. Trust that the experts know what they are doing. Trust that when you go there, you will be taken care of. And I remember the principal nursing officer saying, if you have requests, be reasonable with your requests. Again, Dr. Breedy and her staff, thank you so much for your work. Our next presenter this evening, I'm sure his will be filled with passion too, but not the same kind of passion. We welcome the Acting Deputy Chief of Police, Superintendent Davidson Valerie.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, National Epidemiologist, Dr. Shaluddin Ahmed, Medical Doctor of the Quarantine and COVID Center, Dr. Tora C. Breedy, members of the media, members of the listening public, good afternoon. The COVID-19 pandemic continues to be a dangerous virus, which is having debilitating effects on health and economy worldwide. Dominica is not immune from the catastrophic effects of these dreadful virus. And unless we all, as a nation, adhere to the established protocols in place to protect ourselves and country, we stand the risk of immense danger. The Commonwealth of Dominica Police Force remains resolute in its efforts and commitment at minimizing any spread of COVID-19 in Dominica. We continue to patrol our borders and be vigilant as we seek to minimize and prevent any illegal entries or departures from Dominica. Over the last week, we have had no addition to the seizures of vessels and arrest of persons for illegal entry into or illegal departure from Dominica. We are not saying these illegal activities have ceased. However, we will continue to pursue anyone who we have sufficient confidence and evidence have entered the country illegally. Again, I want to sound a warning to both owners and captains who are involved in illegal movement of people to and from Dominica. Your conduct is harmful and injurious to the safety and security of Dominica. The police force is engaging all means that are reasonably necessary to prevent and disrupt these illegal entries and exits from the island. Those of us who have relatives, friends, or children who we know are involved in these illegal practices, please speak to them. Warn them against these activities. Anyone found committing these illegal activities will be dealt with swiftly according to law. Additionally, I want to warn the persons involved that you are endangering your lives, as the police will treat every situation they encounter according to its merit. I urge you, therefore, abide by the law. Every person entering or departing from Dominica must do so through a legal port of entry. I wish to thank the police department for their efforts at trying to prevent illegal migration. I also want to thank the public for the assistance being provided to the police in our collective efforts at preventing illegal entry into and exit from Dominica. I urge you to continue to report any activity which involves or is suspected to involve these illegal entry and departures from Dominica. Finally, I want to remind the business places to conform to the guidelines relating to the wearing of masks and social distancing at your business place. Together, we will and must work to save Dominica from any spread of the COVID-19 virus. Thank you.
Once again, our thanks to the Acting Deputy Chief Davidson Valerie. We've been working very closely with the police for a long time now. Again, their services cannot be understated. We thank you for your collaboration with us the past few months. And before we come to an end, I welcome as our final presenter, the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre.
Let me first recognize the presence of our national epidemiologist, Dr. Shalauddin Ahmed, medical specialist at the Quarantine and COVID Center, Dr. Tora C. Brady, Head of Criminal Investigation Department, Superintendent Davidson Valerie. Pleasant good evening to all listening here at home and abroad. I would also like to thank them for their very informative presentations this afternoon. As you've heard, we presently have 4 active cases of COVID-19, all of which are due to importation. The world has been battling this pandemic over the past few months and will continue to do so until a vaccine that is not only safe, but available to everyone, regardless of socioeconomic status, can be developed. In the absence of a vaccine, we must come to grips with the fact that COVID-19 will be with us for some time. It is also for this reason that adjusting our lifestyles and making sacrifices has become even more relevant. But we can only have maximum impact in dealing with the COVID-19 pandemic if it is done together. It is a collective approach, an all-inclusive approach. That is, everyone playing his or her part and functioning collectively. We have opened our borders, and as expected, like all other countries, we did get imported cases of COVID-19. Rest assured, the Ministry of Health continues with its interventions, which are geared towards augmenting and improving our existing services and activities. Our focus remains on prevention, rapid detection, and appropriate targeted response. That way, we will be able to reduce the morbidity and mortality related to COVID-19, as well as reducing the socioeconomic impacts from repeated lockdowns. The 4 main areas of action are improving coordination, planning, and monitoring with the aim of having no transmission or low-level transmission and preventing cluster of cases or community spread. Number 2, strengthening the capacity for surveillance, which includes data collection and dissemination for contact tracing, procurement of supportive IT equipment, as well as minibuses and retrofitting of quarantine facilities. Number 3, increasing testing capacity through procurement of laboratory equipment and supplies. At present, we can carry out 70 plus PCRs per day. The intention is to double this. As we have also received on island another PCR equipment, which will enable us to further increase our testing capacity. Number 4, safety of healthcare workers and case management, not only to review infection prevention in health facilities and the community, but also to prepare for treatment, thereby preventing transmission. This also includes training of staff, provision of infection prevention and control supplies, and wash stations. However, with all of the above mentioned interventions, adhering to the public health and social measures remains the key. We must continue to wash hands regularly, proper wearing of masks in shared spaces, proper respiratory etiquette as regards to how we sneeze and cough in public, and observing physical distancing. It is also very important that we avoid all non-essential public gatherings as much as possible. There will always be time for social gatherings in the future, but as of now, we should refrain from planning such events. We are appealing to those in mandatory or self-quarantine to see this as their contribution in the fight against COVID-19. I'm also appealing to all bus drivers to assist us by making sure all passengers wear a mask and all business places to enforce the public health and social measures and guidelines put forward by the Ministry of Health. Let us continue to be our brother's keeper and show a public spirit of concern, educating each other, and even informing the authorities of possible illegal entrance into the country. We should rely on official sources for our information and avoid spreading unconfirmed reports and hearsay. This only breeds panic and anxiety, which does not help our cause at all. Before ending, I must express our deepest thanks to WHO and PAHO for their continued support in helping us secure funds under the Pandemic Emergency Financing Facility. These funds will help us implement the 4 areas of actions which I mentioned earlier. Also, much needed testing supplies which we continue to receive from PAHO, with the help of RSS for timely transportation to us here in Dominica. I also want to thank the International Atomic Energy Agency for a new PCR machine which we received. It's on island, and it will be set up at a separate center such that we could be having PCR tests done at our Princess Margaret Hospital and a separate center of excellence at Stock Farm. The People's Republic of China for providing us 100,000 masks and testing supplies and personal protective equipment. We also want to thank the Republic of Cuba for providing us with healthcare professionals, and also the government and people of India for a series of medical supplies which we received just last week. We are also thanking the Bolivarian Republic of Venezuela for the testing supplies and personal protective equipment received. Last but not least, our frontline workers. Words cannot express our thanks. And a special thanks to the staff at the quarantine unit for a job well done. We would appreciate if those in quarantine would cooperate with the staff at the quarantine unit. They're not doing it for fun. They're doing it to help you, to help your relatives, and to help the country as a whole. May God bless Dominica. May God bless us all. I thank you.
Thank you once again to the Honourable Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre. Once again, special thank you to all of our other presenters. I'd like to remind the listening public of the public health and safety measures that we've been stressing for some time now, including the wearing of your masks in public, hand washing, proper hand washing, physical distancing, respiratory etiquette, and of course, cleaning and sanitizing. We want to thank all those of you tuned in. We want to thank our media partners for their cooperation. And we continue to ask again for your patience. We continue to ask for your support, the general public, because we cannot fight COVID-19 alone. Good evening.